Yesterday, scientist Andrew Wakefield published a report suggesting that there is a link with the MMR vaccine to autism and bowel disorder. Wakefield studied 12 children and reported drastic changes in their behaviour after they received the MMR vaccination. He says that the combination of the 3 viruses contained in MMR may overload some children's immune systems, causing a bowel disorder which could be related to them developing autism. Wakefield said that if there is a link between MMR and these conditions, the risk might be avoided by giving 3 separate vaccines 1 year apart. Our medical correspondent James Verity investigates.
MMR stands for measles, mumps and rubella. They're really serious diseases. Measles used to be as common as chickenpox, but it was much worse. It can be mild, but complications were very common. It badly affects around 1 in every 15 children that get it, and includes chest infections, fits, swellings of the brain, and in rare cases, brain damage. In very serious cases, measles kills. It's highly contagious and can be spread through a cough or a sneeze. And I'm here today in Whittingfield with Ivor Mop, a 65-year-old retired caretaker of Bishop's High School. Mr. Mop, what can you remember about MMR from when you were younger?
In the 1950s, when your grandparents were children, around 500 children a year died from measles in the UK. They also had frequent outbreaks of other diseases like mumps and rubella in those days. Mumps can lead to meningitis in children, and rubella could cause miscarriage in pregnant women or blindness and deformities in an unborn child. Most people now don't remember how bad those diseases were.
Thank you, Mr. Mott. Now later I'll be talking to a teacher of autistic children, but for now, back to the studio.
Thank you, James, for that insight. We have with us here in the studio a Dr. Willie Makitt, who specialises in vaccination. Dr. Makitt, can you tell me more about the MMR vaccine?
Well, children are given a vaccine to protect them from measles, mumps and rubella at about the age of 1, with another dose given before they start school. The vaccine is commonly called the MMR. The vaccine may cause mild symptoms such as a skin rash, fever or swollen salivary glands for up to 3 weeks after the vaccination. However, after that, you are protected from the diseases for the rest of your life.
And exactly how successful is the MMR vaccination programme?
Well, since the MMR vaccine was introduced in the UK, the cases of measles fell from around 80,000 a year to less than 10,000. The number of deaths fell from an average of 13 per year to only 4 deaths during the following 8 years. It is used in over 100 countries worldwide, and health officials say that 95% of children should receive the MMR to prevent outbreaks. Experts say that vaccination programs have probably saved more lives than any other public health intervention, apart from the provision of clean water. Some countries won't let children go to school without it.
So what's going on with the MMR?
Well, no vaccine is totally free from side effects. However, scientists and doctors have calculated that the risk of serious complications from the vaccines is much lower than the risk of getting one of the diseases.
Thank you, Doctor, for your insight. Our medical correspondent James Verity has gone back to school to find out more.
Now I'm here with Mr. B. Quiet, who's a special needs teacher at Bishop's High School. Ben, what is autism?
Well, I teach some children with autism. It's a type of disability. Around 1 out of every 100 people in the UK has it, but you can't always tell by looking at them. They often find coordination difficult and can find it difficult to make new friends and to understand how others feel. Sometimes there are learning difficulties and they may need extra help at school. The number of children diagnosed with autism has increased dramatically here since the 80s. This could be because doctors are better at spotting it, or because there are more children, or there could be other reasons. Whether children today are more likely to have autism than before is difficult to say.
Thank you for that, Mr. Quiet. Now, back to the studio where I hear we're having some breaking news.
Thank you. Yes, that's right, James. We have just received a statement from the Medical Research Council which declared there is no evidence to indicate any link between the MMR jab and bowel disease or autism in children. They are advising that the UK government should not provide single vaccines on the NHS, as they would leave children unprotected for longer and raise the likelihood of epidemics. Reports of a 14-year study in Finland are also just in which trace the side effects of the MMR jab. Out of 3 million children, only 31 had possible indications of bowel problems, and none of them developed any signs of autism. James, what impact will this report have on the public?
Well, the World Health Organization and the Department of Health are all saying that the MMR vaccination is better than having 3 separate injections, because children could be at risk of catching the diseases in the gaps between the separate vaccines. But here, reports of Wakefield's study linking the vaccine with autism has already led some parents refusing to vaccinate their children with MMR. Some are paying for the separate vaccinations, others are not vaccinating at all. Experts say that unless 95% of children are vaccinated, outbreaks will happen. The levels in some towns are already dipping below 90%. Doctors are worried that if unvaccinated children catch these contagious diseases, they could become seriously ill or pass them on to vulnerable children who aren't yet old or well enough to have had their vaccination. The Prime Minister's son is now due for his vaccinations, and all eyes are on him. A press conference is expected later today. James Verity, BC News, Papworth Hospital. What should the Prime Minister tell the public when they ask if his son has had the MMR vaccine?